Good evening, and you are joining with iMed, a program that is central about the health of the human body. So today also we'll be speaking about a health condition when it comes to the heat and the temperate condition we are having in Sri Lanka, because when we have that, the skin out of everything that we have starts reacting. And today to speak on that and the diseases connected to that, we have Dr. Nisansala Nagunavithana, consultant dermatologist from the Surg John Kotarawala Defence University Hospital, joining us today to speak about extensively about these conditions that you might be having because of the heat and the temperate conditions in Sri Lanka. Good evening to you, Doctor.
Good evening, Varun.
Great to have you on board once again. And so, continuing from the last week we spoke about eczema, another very common condition among Sri Lankans. And so, wherever you are, whether it's temperate condition or it's this cold condition in the environment that you're living in, you can still get it as long as you're dry or at the same time could be having sort of moistured skin at the same time. So both conditions do apply here. But then again, if you come to Sri Lanka and speak about the condition here in Sri Lanka, how it is like to live in a country that has where you sweat a lot, where you have so much secretion happening in your skin, and then also outside dusty environment at the same time, and we are all prone to it because skin, being the biggest organ, gets all the incoming messages from the environment. So what are the conditions in Sri Lanka and in the temperate condition that you can get when it comes to skin disorders?
Yeah, so first is there may be conditions that are pre-existing conditions can get exacerbated when there's overheated, more sort of humid environment as in sort of mainly Colombo and the suburbs. And also the other thing is you can get new things coming up on the skin, especially the superficial skin fungal infection or bacterial infection. Those are the quite common things that we see in our daily practice. So moving back to our previous, the pre-existing conditions, as you correctly said, eczema can worsen when there's very hot environment where the patient tends to sweat more. Any of us, we tend to scratch and feel itchy when our skin is sweaty.
It's almost uncontrollable sometimes. When you itch, you must itch.
Exactly. So the problem with these patients, the patient with pre-existing diseases, usually they have a problem with their skin barrier. So when you itch, you scratch, and then you take a little bit of the skin away, and which further compromises your skin barrier. So this goes on, and then because the skin is very sensitive and almost hyperactive in eczema like conditions, these people can get a flare with these exposures.
Right.
And also even psoriasis, those conditions can get worsened with these environmental factors. And the other common thing, as I mentioned before, is now when it's sweating, we sweat a lot our flexural skin, say the armpits, the groin area, and especially in females under breasts and those areas. So what happens is in general we do have some bacteria and yeast residing on our skin that are meant to have a protective function.
Right.
But when it's sweaty, what happens is the skin, especially the skin folds where there's an occlusion, there's constant rubbing, which sort of we call it maceration, and that tends to cause again inflammation of the skin, which we call intertrigo. It can happen even your webs, toe webs, finger webs, and this
really on your
especially it's very common is somebody who wears shoes on a daily basis.
On your toes.
Exactly, right, toe webs are very common sight. And then so the skin gets, you might notice that the skin becomes very white in between the toes, and so this become a focus for infection. Right. Now secondarily, fungi can come and have a feast there, and also bacteria can get bacteria can get in and then can cause skin infection and soft tissue infection. So especially I think in your previous episode we discussed how the diabetics are more prone to this, to get these infections afterwards. And also the other thing is then there are these superficial fungi called tinea in common terms, that we can develop this very itchy other rash called tinea that again tends to prefer these flexural sites due to this hot and humid weather. So the patient again comes with it. It's very contagious, and this we need to treat the patient. We need to treat these patients because essentially it's a contagious disease. And Yeah, and then you might see certain yeast infections, candida, pityriasis versicolor. So those things are also quite common due to this the alteration of the skin flora.
Right.
Reacting with these changes in the skin surface moisture or the sweating.
Okay. Now you specifically specify the word pre-existing conditions. Now a pre-existing condition in the previous segment, in the previous episode we spoke about, is just a genetic factor.
Yes.
So could there be any other pre-existing conditions that can fit into the criteria of having pre-existed in someone's body?
I'm sorry, I didn't get the question.
No, when it comes to now, you said genetic factor in the previous, the eczema.
In eczema, yes.
Is the pre-existing condition?
Well, no, not exactly. What I said is like, suppose if I have any rashes, like, common is the eczema.
Right, okay.
So then if I go to this sweaty, moist environment and I'm sweating a lot, then definitely I'll get a flare. So the people who on the other hand, the people sometimes when you sweat more, there are certain some people tend to scale on their palms and all that.
Oh,
those
yes.
are quite benign though, but these may not be directly related to eczema. So pre-existing by mean like if any skin disease, if you are having that might get worse.
Okay, right. So you mentioned about using sanitizers. That was in the previous previous episode when it comes to sanitizers and also these moisturizers. Now in Sri Lanka, it's very common. We can see if you visit any store, you can see a plethora, a multitude of different kinds of so many skin products. But how important and how is it possible for you to find the proper product that you might need for your skin? Because we have different types of skin. We have dry skin, we have like scaly skin, sometimes you might have even like moisture skin. So how would you find the product that is correct for you?
Exactly. Now Varun, we have cosmeceutical brands and pharmaceutical brands. So over the counter the supermarket, so anywhere you find as you said many of the moisturizers. So I mean basically, and also when it comes to very dry conditions or disease condition, we prescribe like pharmaceutical grade condition moisturizers. What we do is now suppose if you have normal skin or oily skin, in that case you can choose something from the counter, like from the supermarket or the shops. But if you have very dry skin, very scaly skin, then it's better to get some advice from us, because the products sometimes the moisturizers, there can be different the formulation. For example, very liquidy ones like in baby cream, what you see that consistency, or then you have these thicker creams, and also you have very greasy preparation like petrolatum products. So depending on the skin type and your baseline skin condition, we prescribe different combinations. And also for if somebody's work, even though you have very dry, now if you have very dry skin, we prefer to use more greasier products. However, if you are an outdoor worker in this hot humid environment, you might notice that you can't wear this because you don't sweat once you wear these thicker ones. In that case,
it blocks.
Exactly.
Wow,
so in that condition, we usually say in the daytime you can, or even in this period, you can use a less greasier preparation. Like we sort of alter it according to your skin, and also there are not just we can customize these moisturizers by compounding it with the addition of different pharmaceutical drugs into that. So that serves another purpose of treating a particular condition. So there is a wide range, as you said. If you have quite normal skin, like normal oily to normal skin or mild dry skin, you can try several brands and find the optimal product for you. But if still not helping, then try a bit of a greasier product. But if it's not, still you need some help, then definitely we are there to help.
Do you think, you mentioned that at the very end, but then again, I was wondering whether it's very important for anyone who wants to try out a product to consult a doctor first rather than being late and sorry.
Yes, I mean moisturizers, they are everywhere. So there you can find from the shelf. You can try it out, no problem, because obviously the harmful ones will not be out there, hopefully. I mean, in the sense like in a normal sort of shop, right, or a supermarket. So in a general moisturizer, I think you can sort of try it out and see.
It's just moisturizer.
Exactly.
Right. So you also mentioned about the importance of sweating, because out of what you mentioned earlier, I think the most important thing I grabbed is that you must sweat if you're in a country that needs this circulation of temperature in your body. Sweating is important.
Exactly.
But there are products out there that helps you block the sweating, especially when you use them on your armpits, so that you don't. It acts like it blocks your sweat, and also then you also don't have the odor at the same time. What about antiperspirants?
Yes. Yeah, so antiperspirants actually are quite helpful for us, especially when we prescribe these for the patients who have increased sweating condition. Now, sweating, if you don't have, it's a problem, and if you have excessive sweating, it is also a problem.
Okay.
For example, certain people are predisposed to sweat more when they can't sometimes write even because they sweat a lot on their palms. Right?
That's not a condition, is it?
Yeah, that's called so there's a different degrees. We call it hyperhidrosis. So when somebody sweats excessively more than the norms, then it becomes a treatment that should be it becomes a disease that should be treated. So we usually evaluate the patient regarding why is he sweating. We can't just go and block it. We just see why. Whether there's it could be a cause from the brain to up to your skin.
Right. Okay. So it can also be genetic background.
Of course, there are people who get this primary hyperhidrosis. That means you can't find any obvious cause. It usually starts in the small, say, teenage years, and if they sort of becomes anxious, they sweat more, and by night they're usually okay. They don't sweat as much. So those are main things that point towards that sort of primary cause. Whereas secondary means there is an underlying cause. Sometimes, commonly people with thyroid diseases like hyperthyroidism, sometimes diabetic patients, or certain endocrine problems, or some medications, these people also tend to sweat more. So then we sort of go through the history and do examine and then find out what exactly causes it. And then, as you said, the perspirants become a cornerstone in treating that kind of patients.
So it's a good thing to block it.
Exactly, like we need it, right?
Exactly, we do. But then again, like the fact that you block the sweating is totally fine.
We won't block it permanent. It won't be permanent as in any case. So I think if you're thinking about the long-term repercussions of blocking the sweat, I think that may be your concern. But so far there are different studies. For example, talc causing sort of related to certain cancers and all that. But overall, the products that we prescribe are generally safe, and we use it to treat a disease condition. So
exactly. When it comes to disease only.
Exactly.
Right.
I wouldn't really say
only for the disease.
Exactly.
So it's okay to use it.
Yeah.
Okay. Great.
Really bad.
Right. Okay. So we can also speak about now these conditions here in Sri Lanka. Sometimes where people might receive it, or mostly because of this moisture and also humid conditions we have in Sri Lanka. All those diseases that you listed at the first question. Now, does hygiene also play a big role in this? Do you think maintaining good hygiene might help you to prevent this?
Exactly, that's very important, right? So especially because if we sweat more, what happens is when we sweat, we have this special sort of sweat glands on our armpits and the chest areas. That's what gives out that body odor. That's what happens is certain bacteria go and break down this sweat and they produce that odor. The rest of our skin has a different type of sweat glands, for example the palms and the rest of the body. So now if we continue to sort of be in that same sweaty sort of environment, then those bacteria and organisms thrive, and it will produce malodor, and it will certainly predispose to secondary fungal infections. So the personal hygiene is paramount. So sometimes if you're sweating so much on your armpits and all, you might have to shave that area, because that body hair may aggravate the growth of bacteria because it tends to keep the moisture more.
Right.
So definitely personal hygiene is a big yes from us.
Okay. Right. So you earlier in the previous episode you mentioned that using soap is sort of not advised when it comes to skin disorders. If you have any skin disorder, does it apply to all the skin disorders, or it's just something with the opening?
Yeah, no, mainly, no, generally the problem with soap is that it's a base product,
Right.
you know, about the acids and base, right?
Yes.
The skin pH
Just looks different.
so the acids are like, I mean, we might remember from the pH values and all
Yes.
that we had in school. So the skin has acidic pH, say about 4.5 to 5.5, whereas bases, they have, these soaps have a pH value of 7, 8 or maybe more. Right? So when you, what happens when you apply a base into an acid? So the pH will become more. Now if you apply a very, say, pH 8 product onto our normal skin, the skin pH will become, pH will increase. So that is not ideal for normal enzymes and the normal function of the skin. Then the skin might start more, you might notice a little bit of more peeling and skin becomes more dry. So definitely we don't want that in a healthy skin. So that's why we usually advise soap substitutes rather than, you know, generic soaps. So this could come as certain bars. There may be pharmaceutical bars or even creams that you can use. I mean, in general, even a person with normal skin can even benefit from using a soap-free sort of bath substitute.
Okay, so you mean to say, now when you say soap, it's not just the brick shaped item that we use, it can also be shower gel, things like body wash, or those fall into the same category?
Exactly. So I mean, I don't think, not many of the products will have their pH measured or anything. I mean, personally, you might notice once you just use it for one time, you will feel it more dry and you might see a little bit of scale. So that sort of indicates it's not good for your skin.
The silky feeling you might receive is actually could be because of lathering on top of it.
Yeah.
Okay, right. So in Sri Lanka, when it comes to having a hygiene body and a skin, what's the practice you would say? Because I've seen people washing their face a million times a day sometimes, and then sometimes some don't. And then what would be the best? Because I've also heard that having some excretion on your body, especially on your face, is sometimes good, but then here at the same time it's also bad. It is educated to be bad by certain by the outside. How would you like to address this?
Yeah, definitely. Now we have to weigh between, now obviously in these pandemic areas we all tend to bath whenever, if you go out 5 times you bath 5 times, right? You can't prevent that. It's the health is a priority at that time. But in generally you should not, one is the overwashing is also not recommended, because as you correctly said, now our face and the body has oil glands. The purpose of them is to keep the skin moist, and also there are some sort of that provides the natural proper environment of the skin. So by washing constantly we will be ripping off the oils away. And then there is no point of ripping the oils away and putting back by artificial things. But in general I think it should come with the common sense as well. Maybe like whenever you go out and come, you will have to definitely have a wash, and
don't overdo it.
Yeah, definitely, like and also scrubbing. We would advise against vigorous scrubbing
with an item, or like scrubbing with a cream or something.
Exactly, both. Like it's, you should not overdo anything, because do those things, because in the long term you might end up with different skin problems such as pigmentation when you scrub. So I mean, once in a while it may be okay, so you go for this salon procedure or something, but overdoing it on a daily basis is not recommended.
It's not recommended.
Yes.
Okay. So what kind of advice would you like to provide to the public when it comes to preventing these diseases here in Sri Lanka? Because of this temperate condition, things can get quickly growing on your face or in your entire body. There could be like things like fungal infections, like you mentioned. So how would someone, what's the final advice you would like to give to our public?
Yeah, maintaining personal hygiene is very important. And then the thing is, if you get a rash or something, what we commonly find is that patient would go and apply whatever the cream they found. For example, something that was given for a very different skin rash. So they will go and apply it, and thus come with a worsened sort of situation. Because, for example, as you said, the fungal infection, if you put a steroid cream on top of that, it might appear that it is getting better, but on the underneath it may be spreading more. And the moment you stop it, you we'll realize the rash is becoming worse. So that's the exact story they come and tell us. So first thing is, if you have something, please see a doctor so that they can advise you accordingly if you do see a rash. And in general, keep your general hygiene. Do not share clothes or towels.
Do not share clothes and towels. Okay.
Because you can transmit, you can get common sense again, get certain other contagious disorders, diseases from especially these fungal infections and all. And if you can do, maybe use a soap-free wash is better. And if you have, even if you have oily skin, applying a moisturizer would benefit your skin. I think that's, and then general good health, clean eating, and that all that which matters to a good health applies to the skin as well.
Vitamin E is something that you should have.
Vitamin E, let's not overdo on vitamin E2 because they are all fat soluble vitamins. We don't want anybody to be taking a loads of fat soluble vitamins because you can't excrete it out and it can cause problems. So everything in moderation would do. Yes.
So get help from a health professional is what she basically says, because when it comes to using different products and also taking maybe supplements into your body, you might need to be regulated very efficiently when it comes to using health and all these other items as well at the same time. Right. So thank you so much, Doctor, for joining in. And we had a very descriptive discussion today when it comes to multiple topics when it comes to skin disorders and how you can maintain good hygiene and good health and also vitalize skin throughout your entire stay here in this country. Thank you so much, Doctor, once again for joining in. We had Dr. Nisansara Nagadavithana, she's a consultant dermatologist from the Sir Kotarawara Defence University Hospital, who described everything about how to maintain good skin. So we'll come back in the next episode. Have a good night.